Hello, thank you so much for joining. It's lovely to be gathered together again today. I'm very pleased to have a chance to share with you some of the things that we've been seeing over the last few days and where we believe everything is headed with regard to COVID. I'm actually going to talk slightly more broadly than usual. I'm certainly going to talk about the pandemic, but I'm also going to talk about some of the other things that are happening in societies around the world. And I hope these will stimulate some questions and dialogue. I just want to say we learn an enormous amount through these briefings and through your reactions. What you tell us influences what we write in our narratives. It influences what we produce in our videos. It influences the discourse that we have with a variety of different people who contact us each day through webinars or other sessions to talk about the issues. I feel that these sessions are really sessions of family, and I'm so pleased to see that there are a number of people on this briefing who were on previous briefings as well. Do continue to let us know what you think of them. Use the chat line or contact us through other means if you want to. I think most of you know how to get hold of us, and just say, hey David, that's useful, or that's not useful. Of course, some of the things we'll discuss will be quite consistent. There'll be things that we've discussed before. That's okay, because each one of us is coming to terms with what this pandemic is doing and its impact that it's having on our lives now and it's going to have on our lives in the future. And as we come to terms with it, our feelings change and we adapt. And so I'm very relaxed if you're going to ask the same question again and again and again, not least because my answers might change, because the knowledge that I have and that my colleagues have in the World Health Organization is also changing. Also, as you can probably tell, my mood changes from session to session. Why is that? Because some days things feel really bleak. Some days I think, gosh, how on earth is the world going to get out of this one? And then other days I feel hugely inspired because I've heard leaders, and I've heard, now by leaders, I mean people in communities, people in hospitals, people in cities, people in nations, and people in all sorts of different organizations, just saying, yeah, we're finding real reasons here to be optimistic and to be positive. But the news that I start with is not so good. This virus continues to spread. It's now spreading in countries that have really very limited healthcare facilities, very limited capacity to test for people who've got the disease. And so to a degree, we don't fully know where it is, because where there are tests, then a certain number of people will test positive. Not everybody, because the virus happens in quite discrete outbreaks. That's how it spreads. But it's very hard to use testing results now to tell us really where the virus is. What we think is the following. We think that in many industrialized countries that have had very big outbreaks, partly because they were a little slow to close them down at the beginning, these outbreaks are beginning to subside. They're not subsiding because the virus has gone away. They're subsiding because there's been marked physical distancing, which has reduced opportunities for the virus to transmit from person to person. They've also, in some cases, been very good at interrupting transmission by finding people with the disease and isolating them, and then finding their contacts and isolating them, and protecting the people who are most vulnerable. And we've seen that happening in Singapore. We've seen that happening in Austria, in Germany, in Denmark. We're seeing it happening in parts of the UK and France and Spain and Italy and in the US. That gradual building up, not gradual actually, quite quick building up of basic public health capacity to interrupt transmission, supported by the physical distancing that has made it much harder for the virus to move from person to person. And that has truly slowed transmission. And we're beginning to see that hospitals are not now so busy, that although there are deaths being reported, they are often backlogs of deaths, reflecting the fact that a lot of people did die who weren't counted in the figures initially. But there is generally a sense that things are not quite so desperate now in the very intense transmission areas as they were. But in poorer countries, here's the pattern that we've seen. Firstly, they got the message that you have to act quick to suppress transmission and to be ready to deal with outbreaks when they emerge by trying to mobilize all your public health people, giving high priority to contact tracing, and introducing early lockdowns to try to reduce the opportunity for the virus to spread throughout the country. That was very sensible. And I must say that the results I'm hearing from different parts of Africa, from India, from Latin America, and from the whole of the north of Africa, the Maghreb region, as well as Eastern Europe, they're not brilliant results. There's still a lot of the virus moving around. There's a lot of cases and a lot of death, and it's on the increase, but it doesn't seem to be increasing quite at the enormously rapid acceleration that we saw at the beginning in parts of the world where the lockdowns and the physical distancing were not introduced and they were just seeing astronomical rises. So what we're seeing now is nations all over the world demonstrating to their people and demonstrating to each other that yes, we can slow the spread of this virus, and that if we can get good quality basic public health services in place with organized communities that know what they've got to do, then we can actually keep the virus at bay. We still need to be able to impose local lockdowns if suddenly an outbreak builds up. But we recognize that that is part of keeping COVID ready. That is what we're going to have to do for the foreseeable future. So which are the countries that are showing that capacity? Well, firstly, Singapore. At the beginning, they got things quite nicely under control. They used their protocols that they developed for SARS. They were very strict on case finding and contact tracing and isolation. They had quite good testing, and the figures were very low. And then suddenly, whoom, there was a great big spike of cases because the virus got into one of the places where the guest laborers in Singapore tend to live. And so they got a big increase in numbers of cases. They had to quickly really lock down that area, stop movement out, stop movement in, and do, again, very careful identification of cases, isolation, and interruption of transmission. And so what Singapore showed us, that as a country that is COVID ready, you have to be ready when there is a sudden flare up to deal with it in a way that's humane and responsive and ensures the safety of everybody else. And then what about Germany? That's a country that was able to get its case finding and contact tracing built up very, very fast. And that was because they believed that that was the way to deal with this problem. The person who led the German response had traveled to China in mid-February. He'd seen what was done in Wuhan. He had no hesitation but to recommend to the government that you have to react quickly, you have to react robustly. This is not like flu. This is a unique virus, and we've got to be able to deal with it properly. And Germany also drafted in a lot of extra people to support the public health services and had very good testing capacity. So Germany is in a good space right now. Austria is as well. They've got the same discipline. Czech Republic doing the same. Denmark doing the same sort of thing. These are countries that are demonstrating that if they're COVID ready, have got societal defenses in place, they can actually cope with this virus. So there are many developing countries that seem to be getting the message and doing it, though there are some worries that the virus is still slipping through. So I'm not at all certain that they are fully under control. There are some European countries that have shown how it's to be done. And there are parts of the US as well that are beginning to really ramp up their public health capacity, trying to have testing as well available so that they can know where the virus is. And before long, the US outbreaks will subside and they will be able to start returning to the new normal, which is life when you've got COVID with you at all times. Because as the lockdowns are released, as people start to move, we do know that there will be transmission again. We do know that in some places the transmission will flare up dramatically. We do know that that will lead to hospitals being in heavy demand and that health workers once again will be in the firing line. We do know that when that happens, there will have to be local lockdowns that will affect local businesses, that will make people poor. But this time, as these new outbreaks occur in the foreseeable weeks and months, at least societies will be prepared. At least health services will be prepared. At least we will know that poor people are likely to go hungry. And so we'll be prepared to provide them with cash and other support, at least we will know that small businesses will be in trouble and we'll be able to look after them. What I'm trying to say is we won't stumble in and have to find our ways learning while doing and dealing with the lockdowns and the other problems of the early outbreaks. Now we will know what to expect and we will be able to respond in a more systematic way. Of course, the public health people are absolutely vital for this. You can't do this kind of work without really good public health intelligence, really good public health training. You've got to have good organization in the communities. This is a time when public health and the people who know about dealing with diseases in communities, who treat every individual as though they have the same value. These are the people who are at the front of the response, working alongside those in hospitals who treat the sick. And so one of the reasons why I've been really active in the last week is just trying to point out that opportunities for people skilled in public health to meet together, to share what they're seeing, not to be bound by all sorts of political constraints, are really important. And the ultimate meeting place for everybody who works in public health in the world is the World Health Organization. This is, for us, our basic tribal headquarters. It's where we know we belong. It's part of our identity. In fact, most public health professionals are in some way or other connected to the World Health Organization through networks or through associations or through training courses or through reading the manuals of the World Health Organization. It's our center point. And so when one national leader says, I'm going to take money away from the World Health Organization, actually that won't affect the capacity of public health professionals to come together and work under the chapeau of our WHO. In fact, it will require us to work together stronger and in a more determined way. But of course, it actually weakens other countries that depend on the World Health Organization, that the many, many countries that are requiring the World Health Organization to help them get supplies and equipment and all that other good stuff. And so I do hope that over time, and I hope rather quick time, that leaders will come to understand just why at this particular moment, with a virus causing major challenges, we need the World Health Organization. Just a couple of other points. As this virus teaches us that we do have to take health seriously, it's also teaching us that to be working together in solidarity is the only way to deal with a threat like this, that we can't see, that we don't fully understand, and that can cause such terrible havoc. It's a real stimulus for working together. And I think more and more people are beginning to see this. It's not something that's actually rocket science. It's pretty obvious. If you're trying to defend yourself against a disease that presents itself when people have a cough and a fever, and you want societies not to be suffering as a result of this disease, you don't want to have thousands of older people dying because of this disease. What's the most important thing? We have to work together. We have to be responsible. We have to all behave in a way, not just that's to do with us, but we have to behave in a way that's also being responsible for others. And that applies whether we're in employment, that applies whether we're at home, that applies whether we're going and socializing. The new level of responsibility that's going to be required as we come to terms with living with this virus is pretty extreme. We are going to have to keep 2 meters apart from each other unless we know the person really well and we know what they've been doing. We're just going to have to respect that physical distancing. We are going to have, I believe, to be ready to cover our faces when we're in public in order to reduce the risk that if we've got the COVID, we give it to others, or if others have got the COVID, they might give it to us. There's all sorts of controversies about whether masks or face coverings, I should say, are 100% effective. That's not the issue. The issue is we will want to do everything we can to keep ourselves healthy and to keep others healthy. And face coverings, probably those made locally using cloth, will be what we will use, because the special, wonderful, effective filtering particle resisting masks like the N95 or the FFP masks that the World Health Organization tells us must be preserved for health workers. That's the most important requirement for them. And we'll have to learn all sorts of other ways to improvise. We have to learn that our health workers are a most precious asset in our world, and we will have to find ways to value them, to treat them with total respect. Most of them are women, and we'll have ways to make sure that they get properly paid. And then older people, they are feeling very threatened. A lot of them who are currently in lockdowns are saying, am I ever going to see my young relatives again? Are they going to be allowed to come and visit me? Some of them are thinking that they won't. Some of them are very worried that they're going to be cut off and truly isolated, only able to communicate by Skype for the foreseeable future. So there is going to need to be, in this new reality, a lot of thinking about older people. And other areas that we've got to think about, food and nutrition, because of the problem that in many societies, the containment effort does require people to be in lockdown, and kids are getting malnourished. And then we've got to think about education. What about all the education time that's going to be lost now and in the foreseeable future because kids can't go to school or university? And then prisons and other places of detention. How are we going to be able to maintain custody when we've got a high likelihood that prison staff are off sick with COVID and anxiety of prisoners being affected with COVID? But it doesn't just apply to prisons. It's all other places where people are bunked up together in confinement, in cargo ships, submarines, aircraft carriers, cruise liners. That's one lot. And then dormitories for visiting workers in many countries in the world. How to make sure that they're going to be okay. And what about slums? Slums where a lot of people are living close together. How are they going to be able to manage? So this tiny little virus, as it moves around our world, is not only dangerous in its own right, but it unmasks a lot of the fragilities in many of the systems in our society. I've just mentioned a few of them, to do with food, to do with older people, to do with detention and imprisonment, and to do with travel and tourism. But there'll be many more challenges unmasked. This virus and what it does is showing us what we've all got to do to repair our societies. So as well as showing us that we've got to work together in solidarity, it's also showing us that we've got to find the already fragile parts of our societal systems and work hard to make them better. It really is an object lesson in the importance of the Sustainable Development Agenda and the interconnectedness of all the SDGs. For example, that this virus is showing us the importance of leadership by women. And yet at the same time, if we're not careful, the virus can actually exacerbate gender stereotypes and the disempowerment of women. Just want to shift to one other thing, and that is that I do believe that in the coming weeks and months, there'll be more and more recognition among people in their communities, people in their businesses, people in their hospitals, people in their societies, that actually the only way to be strong in the face of this virus and to defend ourselves against it is through collaboration, solidarity, and working in unity. I say that because I'm seeing so many signs of that being a reality. Not just people being kind to each other, but people realizing that this is such a massive threat that actually joint working is key. And that's going to be especially important as lockdowns are released. Of course, there are going to be moments of anger and frustration. There will be demonstrations. There will be possibly violence. There will be a lot of dissatisfaction, particularly when some sections of society are invited to return to employment and other sections are asked to stay in lockdown. This won't be easy for any government to manage. And each government is going to be, at this stage, experimenting, but they'll learn, and they'll learn quickly, because there will be more lockdowns to come. Not big ones, I hope, but they will come. And next time we should be able to do it much, much better. But as well as learning about how to deal with the virus in a much better way, we'll also be learning about the power of collective working in dealing with other massive threats. Here they are, migration. We're dealing with a huge migration crisis at the moment in very many parts of the world. Most of the migration is occurring in Africa and in Asia, There's a bit occurring into Europe. All of us will learn that we cannot go on dealing with migration by dividing it up and trying to be fragmented. It's an issue that needs collective efforts. It's tough, but so is dealing with COVID. Another one is the loss of nature and our failure to value nature in our businesses and in our governance and in our lives. I think we will very quickly through this come together and realize the power of joint working to value nature. And then climate change. We have got to work together on climate change. But I believe that by learning to work better together on COVID, which we will do, as I say, quite quickly, I hope it will be very quickly, but I'm not sure, but that will then equip us for climate change. And I'll tell you why, last words, I believe this. It's because I think that we will find that the results of failing to cooperate and failing to work together, failing to have solidarity and unity, will be just too awful for words. The people who are poor will be poorer. The people who are weak will be disenfranchised even more. The people who are homeless and stateless will be made even more unwanted. The countries that have got weak health systems will find themselves excluded from global education, global economy, global business. Markets will shrink. Businesses will get really mad. And they will really have a go at the politicians saying you must do better. But the most important group who are going to rise up and demand united and concerted action, not with violence, but with giant petitions and lobbying to their elected representatives, will be the people. Something that is demanded by the people of this world in their millions, because as this pandemic advances and as its associated cascading crises advance and systems breakdowns or systems instabilities start to emerge, so people more and more are going to say, this is too important for leaders to squabble over. We have to work on it together. And I'm in this slightly optimistic mood because I have actually today been in several webinars where that sentiment has been expressed. Of course, there's nothing I can do to promise it's going to happen, but I can tell you that I have such a belief in the power of humanity to come through this, that that's what I am certain is going to happen. For me, it's not a case of if it's going to happen, it's when it's going to happen, and a deep, deep hope that it happens soon. Because in an exponential situation, the longer you wait, the much, much tougher your challenge is. I've been writing some of these thoughts. I wrote them down actually sort of 3 long journals at the end of Friday, Saturday and Sunday. And so they're all jumbled together. But we just put out a narrative, which I've called Mid-April Reflections. That's narrative 19 on our website. And then narrative 20, written with John, who's on this call, is also there. I'd like to just briefly talk about our team and who's in our team. And I've surprised my colleague Florence, who's here. So I'll start by mentioning her. Florence, as well as being my wife, is also the managing director of 4SD. And she has been, I think, in a most amazing way, helping us as a group to keep going, connecting with something like, I can't be sure, but something like 2,000 people directly and many more people indirectly each week through webinars and through media interviews and through all sorts of other forms of interaction, occasionally with leaders on one-on-one phone calls, but most often it's through this kind of thing. Thank you so much to Florence. I'd like to thank Twee, who's on my screen and visible. She's got, I think, rice paddy behind her. I'm not quite sure. But Twee is, she's been handling all the communications. She's the person who worked out how to deal with the Zoom bombers, but she's also managing all the Zoom technology. And you can see her smiling there. John worked with me on one of the narratives, the one that's titled Learning to Work Off the Lockdowns, narrative 20. But he's been there with many others on leadership and all the things that are involved. And he's one of the people who's been behind the Living Systems leadership that 4SD does. Joe Colombano used to be a colleague in the UN and is now working with us. He's volunteered. He's actually quite dislocated from his family because he got trapped here in Switzerland when the lockdown started. Joe is an economist and is advising us on the economics that are underlying this. Saber Moumen is our administrator. He's from Tunisia. And one of the things he does is he basically says his brother, who runs a restaurant here in Ferney-Voltaire, he tells us what's going on in his life. And Saber's family in Sousse, they tell us what's going on there, thanks to Saber. And Magali, who came to us from her job in Terre des Hommes, and she not only manages my schedule, but she keeps telling us what's happening in the NGO world and through the connections that she has, and is super connected and has to have a difficult job handling all the schedule. And Catherine Delan, a massively connected health advisor who I worked with over the years in the World Health Organization and other places, connecting us with all different health actors all over the world, but also helping sometimes in some of these connections to really spark something absolutely magic, people coming together and realizing that there are different ways to waterproof PPE, protective equipment for health workers, or that we can find a way to stimulate the rapid production of a new virus test. And then Julian Delamotte, who's actually an elected official in a place near here. It's quite a well-known skiing place called Flen. And the area, the commune around that, that's Julian's area. And he tells us actually what it's like as a local elected official, with shopkeepers who've lost business, with people who are scared, with parents who are getting fed up with the confinement at home. And then obviously the instructions that come saying, continue with your various different things and all the anxieties of people locally. What our team reminds us all the time is that none of this is simple. All of this involves questions and difficulties. We've got people today connected from the UK, going from the north, from Edinburgh, Liverpool, to Cambridge, to London. People from the US, particularly in Maryland, from France, particularly in the Dijon area, several places in Switzerland, close and further. We do have people from Sousse in Tunisia connected. I suspect that's Saber's family. We have people from Benavente in Portugal, or from Winnipeg in Canada, Kathmandu in Nepal. We are a big family, and we will go on trying to spread far and wide. We put the recordings of these online briefings onto our website. And the other day we had some friends who took some of the material from a recording and produced a video without us knowing. They got a network of people together and found some film. They even shot some film. And that video, TUI has posted it on the website. Do have a look at it. It talks about the COVID ready state. We know it's very focused on the situation in wealthier countries, and we will try to provide similar sort of video commentaries for others. And Holly's got her hand up, but Holly, we won't at the moment. Oh, sorry, I didn't realize. Thank you very much indeed. We love that video that's come from Derek and the team, and we hope that you get a chance to look at it and tell us whether you think it's useful for conveying the message. Our whole mission now is to broadcast as widely as possible. This virus isn't going to go away, it's here to stay. We have to get COVID ready, and that means changing the way we behave, but being responsible for each other, working in solidarity as one human family. Whether we're in business, whether we're in civil society, whether we're in institutions, wherever we are, we have to do it. That message has to get out. The other message is that the virus will occasionally cause outbreaks. We have to be able to close them down, and we have to do it without feeling totally stressed. And at the same time, we need cooperation within countries and between countries like we've never done before. And with that cooperation, we can get on and deal with the other existential threats. So question one. Well, older people seem to be particularly at risk. How will it be possible to look after them if this virus won't go away? That is a massive, massive challenge, especially older people who are living in residential care, who are dependent on staff coming in and feeding them getting them out of bed, changing their clothes and washing them, who depend on having visitors for company, the occupational therapist, family. Increasingly, there's going to have to be very major care in these residential centres and indeed wherever older people are to try to prevent them being exposed to this disease. This disease has a catastrophic effect on older people. And we're going to have to learn and be ingenious as to how we can stay connected with older people without exposing them to the threat, as long as the virus is appearing to be transmitted in our communities. It's going to be up to us to find these solutions. It's going to be up to the older people to tell us what they find suits them best. It's going to be up to the rest of us to work out how we can help them. And we're going to have to find ways to better reward and respect the people who care for older people, because we're going to be asking them in their daily lives to do everything they possibly can to avoid being infected with COVID. Because if they get infected and then they bring it into a place where they work without realizing it, then that will be catastrophic. So there's a huge responsibility on the people who care for the older people in communities. And that's partly people who are care workers, but it's partly our families. And I know that this is difficult. And it's something that I'm particularly keen to talk to you about. Do you know 95% of the people who care for older members of our community are women? Do you know that many of these women are on 0 hours contracts and they're having to move from job to job and do multiple shifts? Do you know that that is appalling? COVID is the great revealer. It shows the frailties in our systems. Question 2, how can public health capacity be built rapidly? Thank you. Number 1, people like me need to get better at explaining what we mean by public health. It's not hospitals. It's not health centres. It's the people that we rely on to keep an eye on what's happening right across our communities. There used to be lots of them when there was a fear of infectious disease and contagion, but in many societies that's reduced. Not entirely, and I'll come to that in a minute. But in Western societies, there has been a reduction in public health capacity. The public health people mostly do things like investigate restaurants for hygiene and all that other stuff, very important. But now there is a need for many more people responsible for public health. Some people say it has to be one per 500 households, something like that. Or in my thinking, it may be 1 per even 50 or 100 households. You can't do that with salaried staff. Got to have some way of working with volunteers in communities to do it. But that's what public health is. It's a web of interactive people who basically maintain a watch over the health of individuals, identify those who are not well, identify those who need support, but do it in a way that is totally empowering and supporting, and making certain that if they are ill, they can get help and they know what to do. And so what I'm hearing from more and more countries is that they're taking on people, either as direct employees or as volunteers, to strengthen public health capacity so that there is a truly connected web across the community. That's been the secret of Germany's contact tracing. Now, actually, in many of you have worked in or are working in countries that are poorer. Namaste to our colleague who is here from Kathmandu. There, the possibility of taking on lots more staff for public health services is not really very easy, but actually we find that many existing health programs have got community level workers in place. And so it is possible to invite them, as well as they're doing their other work, which is so terribly important, like immunization or child health or polio immunization, that they can also be part of this web to find people who might have COVID and to look after them. So actually, I do believe that in poorer countries, there is real potential to build on existing public health capacity and reinforce it. And that should be an asset for many developing countries that so-called advanced nations don't seem to have so well developed. Anyway, it's bringing in more people, organizing, creating a whole web, recognizing that when you are a public health person, everybody is a hero, trying to help those who do isolate quickly if they have symptoms to be seen as the ultimate heroes and supporting them with whatever they need. Question 3. Are there signs that countries might invest more in their public health systems after this pandemic to keep them in good preparedness necessary for their future? Absolutely, there are. And you know, more and more people are realizing the value of public health. Businesses, for example, realize that it's difficult for them to do their businesses well in places where public health is weak. So there's going to be a huge demand for reinforced public health systems as this pandemic evolves and as we move into the COVID-ready state that is the state of the future. Indeed, without strong public health, interactions between governments are going to be very, very difficult. My colleagues, I see you on this call, don't hesitate to just mark to me if you feel that there are things you need to add, because I know these are issues on which you are all working. All you do is you turn on your video, unmute your mic and make it clear to me that you'd like to be brought in, because I don't want you to feel that I'm just going to go on and on and on talking, especially if you've been doing a lot of work with me on these issues. Question 4. I'm wondering what the best hopeful message is to countries with limited resources. For example, Afghanistan, countries also in other parts of the world with the same limited resources. What can be the hopeful message from the rest of the world? Firstly, thank these countries for taking the issue seriously right from the start, even though it's been a huge struggle because they had to persuade their people to accept lockdown when there were only a few cases. And the people said, why are we being asked to do this? It's not really a threat. But if their governments had waited until the outbreak advanced and there were lots of people sick and dying and hospitals overwhelmed and health workers losing their lives, then it would have been terrible. It would perhaps have been okay from a public relations point of view, but it would have been an avoidable tragedy. So in all my dialogue, through the media or in person with people in poor countries, I am saying, thank you for moving so fast on behalf of your people and on behalf of the world. Secondly, I'm saying, thank you for your existing community infrastructure, your community health workers, to make certain that contact tracing is done effectively and to provide this public health web. That is so important. And that's an area where people from poor countries have got something to teach people in the rich countries. Thirdly, I'm appreciating the fact that they have done everything possible to make their health facilities COVID ready, even though they haven't got fancy ventilators and so on. You can do an awful lot if you've got oxygen. And if you haven't got oxygen, you can do an awful lot with one of those bellow devices that we use for resuscitating people when we have very limited facilities, just simply to help them breathe. You can do an awful lot with effective physio to help people lie on their chests when they're sick to breathe. They find it easier to get air into their lungs, and there are breathing exercises they can do when they're seriously ill with that terrible problem of stiff lungs that you get. You can do an awful lot, and countries are doing it, to work through local community organizations to make sure that people who are hungry can get food, that people who are in any way persecuted and discriminated against, for example, with violence in the home, can get shelter. And I'm seeing that being done. There are so many messages of just beautiful things happening in poorer countries because they are taking advantage of their community organization. That for me is hopeful. And the fact that many, many countries moved so fast when rich countries moved so slowly, that many poorer countries were so robust and involved all of society when rich countries just weren't quite sure what to do, has been a blessing, because the virus has been multiplying like crazy in rich countries, but poor countries have moved very quickly and responsibly in many cases to get on top of it. Not everywhere, but I think we have a huge debt to poor countries, to their governments and to their people for the sacrifices they're taking on behalf of all. Question 5, how do we move forward on the climate crisis in the midst of the COVID emergency? So important. COVID is showing us that we have to pull together. COVID is showing us that we can pull together. COVID is showing us what we can achieve when we do pull together. And we need to bear that in mind and feel proud about it and take it into climate. Because again, on climate, it's the actions of all of us that's going to make the difference. We will be able collectively to exercise much more pressure on those who are emitting irresponsibly if we can pull together. And that is what we have to do. We mustn't forget that COVID is revealing multiple frailties in our systems. And COVID is showing us also some of our strengths. And that will be how we will get better on dealing with this climate crisis. Most importantly, COVID is reminding us of the importance of resilience of societies. And that same for dealing with climate. Question 6, thank you for the public health information in the face of so much false information and rumors. What sources can we use for accurate, helpful medical information about risk factors such as BMI and age, transmission methods, and the effectiveness of various treatments? I'm still saying to you that for me, the World Health Organization has the stuff. The only thing I would say to you is it's quite a challenging website to navigate. I used to work with WHO and I knew how difficult it is, because on the one hand, you want to provide easy access for the person who just lands on your website and clicks, and you want to seduce them to come in. On the other hand, you want to have a library that's kind of quite well catalogued, so the people who've got very specific needs, such as the relationship between body mass index and fatality risk amongst particular ethnic groups, can get the best information. And to do that second part, the cataloguing and the easy access sort of wiki medical for COVID is super hard to do, especially if you're doing it while you're working. And I think my colleagues in WHO know that they've got more to do. If you're stuck, please do let us know. You know, we are connected in to that system. And if you think there are things that are just really awfully lacking, do tell us. Our colleague Catherine and I have been really wondering, how can we share information about apps for helping people who've got COVID to be able to get their symptoms sort of looked at by somebody who's a bit medical. And they are beginning to exist, but there's not a nice central clearinghouse for these apps. And then on transmission methods, yes, there's very good stuff in WHO on that, but you have to get into the guidance to find it. And the effectiveness of medical treatments, all I can tell you is that there are questions and answer parts of the WHO website that do cover things like hydroxychloroquine and also other treatments. Question 7, I'm concerned about people who are homeless, who have no support, refugees, illegal immigrants, people who have no identity and cannot apply for any help. How can we collaborate to help these vulnerable people? I did mention earlier on, I'm just going to get rid of a window that's popped up. Thank you. I did mention earlier on that actually now more than ever, we realize the importance of groups who focus on those whose human rights are being, what's the right word? Anyway, who are not able to realize their human rights, and those who are actually in any way disenfranchised. They need support now. And they need all of us to identify them and support them. And again, COVID illuminating the frailties in our society. The frailties of the disenfranchised, of the oppressed, of the refugees are so, so serious and so important. And as I said, in public health, we believe every life has the same value. So if any of you are working with groups who are disenfranchised and who want to know of others who are doing so, let us know and we will do our best to connect you. We have limited capacity to do this. We only have a few leads, but we'll do our best. And really, this is a time for connecting and solidarity, because now more than ever, they need our support. We have contacts with people who are homeless, who are food poor, and who are dealing with refugees. And we are hearing all the time of their particular needs. And yes, they get support, but the support has to be meeting them where they are, not support that's provided with our view of what's going on. It has to be support that's geared to their environment. It has to be support that tries to understand the priorities that they have rather than our priorities. It's tough work. So again, please be in contact. I will do my best to connect. Question 8. What is the impact of border closures and quarantines in suppressing or eliminating the virus, given the hostile political environment which such moves can sometimes create? I'm going to say to you that when you've got an outbreak that's building up quickly, the most important thing that you can do is to stop people traveling out of the place where you have that outbreak. That is the ultimate way of interrupting transmission and preventing the seeding of the virus into other locations. Stop movement out. It's not stop movement in, it's stop movement out. And so one of the reasons why the Chinese were praised in January was that one of the earliest things that they did when they realized what was going on in Wuhan was they stopped movement out of Wuhan. And they did that to stop the virus going to other parts of the country. It was a clear and correct thing to do. Now, countries of Europe, when they knew they had vast amounts of virus moving around, they have not stopped movement out. And that's not happened in other parts of the world as well. So I want to keep stressing that the right thing to do is to stop movement out of a place where there is high transmission. That's the best thing to do. And of course, countries will want to stop people coming into their countries from other places. But we need to check one thing. I often hear it said, oh, well, we're going to close our borders to people coming from country Y unless they're our citizens. But what's that all about? A citizen of country X who's in country Y, where there's a lot of COVID being transmitted, is just as likely to bring COVID back as a non-citizen of that country. That's why the WHO asks countries to explain why they impose these various restrictions, not to be funny, not to poke fingers at them, but to explain to them when there are decisions made that don't align with our understanding of how the thing is transmitted. That's why questions were asked, for example, of the United States. That's why questions are asked of the 16 other countries that did that kind of border control close to the beginning. Only because there were aspects of what they did that didn't quite make sense. A quarantine is important. Trying to stop people who have contacts from moving and spreading the virus is an absolutely vital part of control. And if you can't quarantine individuals, you may have to quarantine. And if you can't sensibly quarantine households because everybody's close together, then you may have to quarantine whole communities. And that's a needed public health measure. It must be explained. It must be done in a very, very soft way. No use of live rounds, point I keep making, something I learned from the president of Liberia during Ebola. But it may have to be done. But everything should be explained. There's no rocket science about this virus. It is possible to explain to anyone about how it's transmitted. It's possible to explain to anyone the principles of containment and suppression. It's possible to explain to anyone why physical distancing has to be imposed suddenly. It's possible to explain to anyone why you don't want people to move out of a place with high transmission. And I think it's possible to explain what are sensible border actions and what are perhaps those that need to be re-examined. And gosh, I've been asked so many people about, you know, why did WHO this, that, and the other? And I keep thinking to myself, yeah, we can explain everything. We're just ordinary people in WHO, people like me, public health people. We're not some kind of people involved in some funny political games. We're just trying to do our job within the rules that are set for us. Anyway, I've been doing that a lot. I did a thing called Hard Talk yesterday. That was hard. And it was talking, but it was hard. Anyway, first time I've ever done it. Question 9, any suggestions on the best places to look for reports on impacts of COVID-19 in rural communities? Well, I do think that the impacts are quite different between rural communities and urban communities, just because transmission is more likely to take place in urban communities. However, I don't have any straightforward information. I like to hold that one, but I do think that we have two organizations that are keeping an eye on the more general impacts of COVID on, for example, agricultural systems and food systems. They're the Food and Agriculture Organization and the International Fund for Agricultural Development. The organization keeping an eye on COVID and hunger is the World Food Programme. Excellent group as well. So that's, I think, one that I would look at those two websites, but please come back to us. Use the contact@4sd.info web address if you want to. If you find something, please tell us, because we need to learn from you. Question 10. Given what you've been saying today, how do you see the collaboration moving from the medical discussions into the global sustainable development forums? Has it blown the 2030 agenda off track? Okay. Antonio Guterres, the Secretary General of the UN, produced a report about 2 weeks ago on the social and economic implications of COVID. I think it's a really great report. It's been really well put together. It's looked at COVID and youth, COVID and women, COVID and the economy, COVID and society, COVID and discrimination, COVID and refugees, COVID and humanitarian situation. And at the same time as writing this report, the Secretary General brought together all the different parts of the United Nations system and said, yes, this is a public health crisis, but it's also a crisis that needs to be addressed through the lens of the Sustainable Development Agenda. And he said, come out of this stronger in appreciating the Sustainable Development Agenda. And in the last part of that report, it's the most important part, it's looking forward. As we emerge through these current big outbreaks, what's it going to be like? I'm going to say this outbreak and the collaboration through this outbreak is helping more and more of us to realize the importance of the 2030 agenda and why we need to make it more central in everything we do. And I don't think that's just wishful thinking. And I'm not, at least at the moment, saying it's blown us off track. It's actually, I think, brought us more in line. It's lined us up with that wind rather than blowing us into the rocks. Question 11. What must businesses do if we're to get people back into work safely? So I want to say that the team, John, who's on this call, John Atkinson, have produced a narrative, number 20, titled Returning to Work After Lockdown. It's quite long, but I think it's an easy read, and it's come from, Florence is saying it's not long. Florence is saying it's not long, it's just that she printed it big so I can read it. Haha. That's one of the things, you see, your eyes get less good. So I like it, tell you why, and it's come out of John's head, because it's saying effective locality defenses against COVID right at the start. What we all need to be able to do, have drummed into our heads. It's sort of, it's actually, the acronym is CERTIP, but that's not useful to you. We need to actually learn the things. Then it says how it acts on business. And he talks about the need for trust, because we have to trust staff to self-isolate. We need to support staff when they're self-isolating. We need to take people's temperature. We need to test them if we possibly can. And we need to trace the staff to make sure that those with whom they've been in contact isolate as well. And then there's a lot about physical distancing, hot desking, working from home, PPE if it's necessary. Though I don't actually think, we need to be careful about the use of the term PPE, because that's really a term used for medical people. So we need to enable staff who are exposed to protect themselves. And then we need to have ways of dealing with events and conferences. Now, this was informed by all the group, and I want to acknowledge every single one of them for the help they did to get this right, and particularly the work that Joe has done on COVID-ready economies. Thank you very much indeed. And now I'd like all of you to use that and to draw on it, because and then we can follow up with you individually if it is helpful. And now to question 12. How can we make sure that the large stimulus packages agreed to address the crisis go to those that need them most, rather than those that are simply bailing out large corporations? Wow. Well, this is where Joe and his team have been working. This is what the IMF is looking at. Quite honestly, it is really not appropriate at all if public money is to bail out large corporations that are failing. Yet we know that that is what is happening. And we know that there are many big corporations that are asking for bailouts. Paul Polman, who's a leader on sustainable development, was just now talking on a meeting of the B20, that's the business group that supports the G20, saying there has to be some ethics applied to how governments offer their bailouts. The only way to deal with this is through citizen action, through watching, and through calling governments to account. No public money should be used to bail out large corporations unless there's a very good public good element of this. I think that's a reasonable statement, and it's one that I would like to see put into practice. Everybody, I thank you very much indeed. I'd like to come to my lastest question. How do we fully work in solidarity across nations in a unified effort when we see powerful leaders damaging global efforts? We tell them to stop. And we say it again and again and again. And if we can, we name them. If we can't, we at least say how totally destructive that practice is. This is a global emergency. It needs a unified global response based on principles of solidarity, equity, and human rights. And it needs enlightened, multi-actor systems leadership that has the living systems of our universe right at the center of it. We have to be confident that we're right. And then we have to speak what we believe wherever we can, not in anger, because we're not angry. It's just that we know what is needed. We may be frustrated that it's so slow coming. We keep up the message. And we have to get that message not just to the ones who are the leaders, but to the ones who are their supporters. Not all their supporters are die hard in that groove of denying any kind of global interconnection. An awful lot of people are around them in a sort of fringe thinking, well, perhaps they are right. Perhaps it is better just being on our own. Perhaps it is better just creating a wall around our community or a wall around our country. But we have to keep reminding them that whether it was coming to terms with the need for sanitation and hygiene to deal with the threat of cholera, coming to terms for the need for safe sex and similar practices to deal with the threat of HIV, or just simply the importance of respect and love for everybody, particularly for our families and our friends, our children and our parents and our neighbors and all of those we work with, and as well the people in our wider community and circles, even those we don't really like, even those we don't really enjoy being with. We must connect with them, because it's that capacity to be totally connected as humanity. It's the only way this is going to be resolved. And you know, most of these people who want to kind of be all concentrated and condensed and contracted, secretly they know it as well. They're just scared of connecting. They're scared that it will expose them. And we have to bring them with us and help them not to be scared and not to be frightened and not to be alarmed and not to feel they'll be exposed, because they're welcome as well. Because that's the only way. Thank you for being with us today. Thank you for staying. Thank you to the team, as always. But most importantly, thank you to you. You have messages to share now. You had them already. I haven't said anything that you didn't know. All I've done is, like the COVID, I've exposed things that you've believed, and I want you to lose no time or effort to get that message of global solidarity into every corner of every place where you are, because that's what matters. Use the lockdown wisely. That's what you can be doing. Good luck. Bye-bye. Thank you. Stay well. I'm doing a big wave. Big wave. There you go. Tracy, you're hidden. There's a sort of thing in front of your camera. Waving. There you are. You're waving. Thank you. Nice to see you. Twee, waving to you. Holly, waving to you. Lovely to see you. Have you got a little boy there? There he is. Hello, Isaac. We're doing this for you and your generation, Isaac. That's great. Hello, Holly. Hello, Matthew. Nice to see you. Hello, Maria. Lovely. And everybody else. Sangram, great you're on. Rojan, thank you for joining. Namaste. Aram ganas tabaile. Tabaile covered my lepotanus. Deri Daniban. Saber. Matthew, where's Matthew? Matthew, you're there. Yeah, Matthew, lovely to see you. Great, Matthew. Aileen, Sarah. And then Thinking the Unthinkable, you're in as well. Thank you very much indeed, all of you. Wonderful. Lovely. Kathy, Joe, David, Metzi. Thank you. I'm now going to ring off. It's too nice to want to talk to you, but we have to do the next thing. Bye-bye. Bye-bye.